Hello, everyone. Welcome to another chat with Beyond Type 2. I'm Tiara, and I'm the Senior Project Manager of Beyond Type 2. Beyond Type 2 is a resource website for people impacted by Type 2 diabetes. We share resources, articles, and tips on how to live your best life with Type 2, including on topics like medication, exercise, mental and emotional health, and more, and also about food and nutrition. However, today's topic, we're going to be talking about hypoglycemia. And I am so happy to be joined by this amazing certified diabetes care and education specialist who's going to talk to us about hypoglycemia and outdoor activities. The weather is getting warmer. However, no matter what season it is, I think these tips from our discussion are going to help you just stay prepared for low blood sugar next time you're out hanging out with friends or out in nature or whatever outdoor activity you're doing. However, I want to introduce my guest, Amy. Amy, how are you?
I'm great, Tiara. How are you?
Good, good. Thanks for joining me today. Would you mind telling the audience about yourself?
Of course. So, hi, everybody. My name is Amy. I'm a dietitian and a diabetes care and education specialist. And as you heard, Tiara, again, because saying it very slowly, because it's kind of our new title. We used to be called, certified diabetes educators. And now we're, again, this really cool new title. But I have been working with people with diabetes for over 20 years. And I work in the Chicagoland area with people with diabetes. So it is such a pleasure for me to be here today and being able to talk with you, Tiara.
Oh, I'm so excited to talk about this because I think we focus so much on high blood sugar and type 2 diabetes, and low blood sugar doesn't get as much attention. And low blood sugar, it can be pretty dangerous. Like if you fall below a certain level, especially when you're sleeping, I mean, it's the kind of thing where you may need like assistance from someone else. But I know today we're going to be talking about what to do if you're just like out. People are getting vaccinated. People are trying to get back to some sense of normalcy now. So we want people to be safe in knowing like the importance of like checking their blood sugar and whatnot. So I guess
Course.
let's get into it. Like,
Let's
um,
do it.
in your opinion, like why is hypoglycemia important for people with type 2 diabetes to know about, and how do you can counsel your patients about it?
Oh, sure. And Tiara, you hit the nail on the head. I think that I'm not saying that high blood sugars and long-term complications aren't important. They are, but they're always kind of given top billing. And then hypoglycemia is kind of left to the wayside. And I think that hypoglycemia is one of those undiscussed, really important topics because, again, the lower that you go, the more likely that you could pass out. And, again, I don't like throwing around that D word, but again, when we think of, I mean, we want you to stick to this, to be in this world. So, again, that's why hypoglycemia is important. And interestingly, it's one of the most common reasons that people go to the emergency rooms or are hospitalized. And the most important thing to keep in mind is that hypoglycemia is caused by many medications that are used for diabetes, especially insulin.
Yeah.
And then especially if you're using sulfonylureas or the glinides, again, because that's what it's doing. Those medicines are kicking out insulin from the pancreas.
Yeah.
And again, if people don't know what their medicines are doing, that's what increases their risk of hypo.
Mm.
Now, one interesting thing about hypoglycemia is that most people think, well, I'm not, it just goes with the territory, or I'm not at risk because, again, my A1C is higher. Wrong. We know that multiple things, it doesn't matter what your A1C is, your overall control. Again, you can still be at high risk for hypoglycemia. Remember, again, one major thing that we have to keep in mind is that somebody's on insulin, they need a glucagon prescription, because, again, it goes hand in hand. We're going to get into that in a little bit later.
Yeah, yeah. And it's I'm so glad that you said like the misconception of my A1C is high or I'm always high. So there's no way I could be, affected by low blood sugar, but it takes like just one time, really. And it's acute. And I think that's a good way to think about it, that it can strike at any time, especially when you are taking certain medications, you don't know what they're doing, or especially if you're on insulin, if you're not sure how to work your dosages. One thing I've heard a lot of is like how some people with type 2 are counseled to take like a certain blanket set of insulin dosages, but they don't adjust the insulin dosages depending on the meal. So if you're eating a salad one day and where you don't have a lot of carbs, you don't need to probably take as much insulin as if you're going to eat like a burger and fries. And it's that kind of gap in education that I know I've seen a lot, and I'm pretty sure you have too.
No, absolutely. And I think that, a couple of things that we have to acknowledge is that, yes, so many things that we do in our life are going to affect our glucose levels. And so again, when we think of just taking the same amount of insulin, or even, the same amount of, if you're using glipizide or glyburide,
Right.
again, all of those things, again, you want to have a plan in place to say, if I'm exercising, or I skip a meal, or I'm eating, a light meal that doesn't have a lot of carbohydrate, that's not going to impact my blood sugars. Again, you have to have that plan in place. Now, one thing that all of you know is that, again, depending on who you see, if you're seeing a primary care physician, or again, some other provider in the primary care group, whether it's an endocrinologist, again, they're hardworking folks, and they don't always have the time to be able to give you all that down and dirty. So it is important that, again, especially if you are on Medicare or have some commercial insurances, know that most of the time diabetes self-management education is a covered benefit. And then you could have 2 hours a year with a diabetes care and education specialist to be able to hammer out some of these really individualized recommendations. So again, it's important that you're not alone. Again, it sometimes feels like that, and it's not that your doctor or your other healthcare provider is trying to diss you. It's just that we know that they have this long list of stuff that they have to get through, and usually low blood sugar is on the bottom of the list. But it's really important that you are empowered and you're advocating for yourself to say, what do my medicines do? Do they cause hypoglycemia? If they do, I need to have a plan in place.
Yes, and let's talk about like that glucagon prescription. How
Yeah.
is that something that you have brought up with your own patients, or do your patients already know about it when they come to see you?
Half and half. I think that because I have worked with children and families of children when I first started as a diabetes educator, 20 something years ago, it was just kind of like a protocol. Like, there's no real conversation. Anyone who is on insulin, you're getting a prescription for glucagon. And the glucagon options have changed
Mm.
so dramatically over, well, just even in the last 2 years. So again, we have new options that make it so much easier. And that had a lot to do with why people weren't getting glucagon. Because if you look at, again, when we look at, 6, 7 million people that are on insulin, of those, I think it was like less than 10% that actually would fill a prescription for glucagon, because the original glucagon emergency kits were really hard.
Yeah.
They have, 7 to 10 steps. And, again, in a pinch, if somebody has a really low blood sugar, they're unconscious or unresponsive, you're like, you're not going to be able to do it. And so, again, I think that now with these newer options, it's so much easier. And so, again, definitely, because these newer options are available, more people are coming in and saying, hey, I heard about this. What do you think? And, again, it's usually on my list anyway, like, and even the doctors that I work with now, they're like, we're writing you a prescription. I'm like, yes, the doctors are actually doing it without even being asked. I love it. But, again, we know that, if you're on insulin, if your doctor doesn't ask, it's not because they're doing anything wrong. It's just they have that long list of stuff to do. Ask them. Again, I'm a big proponent of saying the customer is always right. Even though you're a patient, you are a customer. We work for you. So again, make sure that you're saying, hey, I want this. Can you get this for me?
And like that, the new options are so user friendly. I remember when I was first diagnosed with diabetes, and I didn't know what a glucagon kit was, but it wasn't until I started working in the industry, and I remember folks saying like, yeah, it's a little scary if someone is having an emergency. Like, I don't know if I'm mixing it right, or if I'm gonna inject them correctly. But we have, but now, like over the last couple of years, we've gotten the nasal glucagon, Baqsimi, which is like the dry nasal spray. And yep, there it is.
I
And
know, isn't it adorable? I
it's
mean,
so
it's so cute
cute.
little.
And it's great to use because it's like, if I know, let's say if I know if I'm low, because I have diabetes, and Amy, let's say if we're out like on a hike or whatever, and I'm like, Amy, my blood sugar, man, I'm dropping really fast, and I pass out, you could just spray that into my nose, and I don't have to be conscious
Nope,
for it to start working.
no, not
Which
at
I
all.
think is it's very the one that's that's life saving, and also for you as the user, you aren't going to be nervous about like, man, I don't. Gosh, I'm afraid of using a needle. Like you, it really is just spray and go, and then call for help, call for additional help. Um,
Absolutely.
and to kind of segue into like these outdoor sports, like how do you counsel your patients? How should people with type 2 prepare themselves for low blood sugars when they're out?
No, absolutely. And I think that that first step is really understanding which medications that you're taking that are going to lead to hypoglycemia and coming up with a plan of action. So again, I'm not a physician. I'm not telling you to do this, but these are just some of these general recommendations that are given that if you are taking an oral medicine like glyburide or glipizide that causes, low blood sugars, and you're going to be out all day taking a walk,
Right.
again, have that conversation with your doctor. They may want to cut the dose in half or eliminate it altogether. And the same with insulin, that again, the general, rules that they have out there, some consensus reports that are out there regarding insulin adjustment and exercise is cutting those fast acting insulin doses in half
Right.
to reduce your risk. But, again, so that's the first part about medicines. The second part is having treatment options available. Because again, remember that when you are using your muscles use sugar for energy. The
Right.
more that your sugar is being pulled into your muscles, the lower your blood sugar is going to go. And so again, we know that all best laid plans, may go astray. So we always, I'm worst case scenario girl. So I always like to have, here's plan A, here's plan B, here's plan C. So again, making sure that you have treatment options for low blood sugar. Now, the general recommendations for treating low is something called the rule of 15. 15 grams of carbohydrate, wait 15 minutes, and then recheck your glucose levels. So carbohydrate, of course, is the primary thing that's going to raise your blood sugar, but we're looking for fast-acting carbohydrates. So glucose tabs are usually the general, like the gold, the gold standard for treating lows, but they're expensive. So again, we know that you can use other options like fruit juice or even Skittles. Again, and usually, but again, it's all about the 15 grams. So again, when we talk about glucose tabs, that's 4 of those glucose tabs that somebody has to chew on, half a cup of juice,
Yeah.
or a fun size pack of Skittles. So again, having something that travels well. And so again, juice may not be the best option, but again, you can have, juice boxes, but they're pretty heavy.
Right.
So, again, keeping that in mind, and you can pick your favorite. I mean, I have patients that like, the sweet and sour, gummies and weird, other things like that. They're not weird, but I mean, I'd say, it's whatever is going to work. But, knowing that, you want to use those types of things to raise your blood sugar. I don't recommend granola bars. I don't recommend, Snickers, even though it sounds like a wonderful thing. But, again, the problem is we want it to raise the blood sugar quickly. If you're using those types of foods that have protein and fat, it's going to slow the digestion and it's not going to bring that blood sugar up fast enough. And then what's going to happen? You're going to go, it's not coming up. Let me eat more. Let me eat more. And then an hour or two later, you might be really high and you're like, oh, I don't feel so good.
Yep. The diabetes roller coaster. Absolutely.
Yeah.
And can you talk about like the different types of like physical activity? Because
Yeah.
we I know we general to physical activity, but there's the difference between going for like a slow jog or a hike, and then there are things like playing soccer or volleyball where you are really like your body really needs the energy kind of up front. Can you
Yes.
explain like the process of
Of course.
like like your blood sugar kind of actually going up a little bit when your body's really needing that energy, and then how it drops? Like,
Sure, sure. No, no. And so a couple things that we have to think, we term exercise in a couple different ways, again, aerobic activity versus anaerobic activity. And then we have to look at intensity levels. So, again, when we're talking about you're strolling around a park, that's a pretty low intensity. But if you're strolling around the park for an hour or two, your muscles are still using that sugar, and we sit on our biggest muscle usually. And so again, we're going to be using a lot of, it's still going to lead to dropping that blood sugar level. So, again, when we're talking about sustained activities, we may need to throw some carbohydrate throughout that time to just kind of make sure that we keep the glucose level up. Now, if you're going to be, again, it's going to be, let's say it's going to be lovely and you want to take a bike ride on the path, I'd say then, and you're going to be 15 miles, 20 miles, again, that also is going to require some additional, like having some extra glucose right as you start, and then a little more kind of as you go. The same now soccer. So interestingly enough, when we think of if somebody's playing soccer or even baseball for that matter, again, or you're playing an actual sport, and again, that could cause the adrenaline or hormone levels to rise and cause the blood sugars to rise.
Right.
And so again, it may not have as big of an impact, because what happens is that our hormones tell our liver, which stores all of that sugar, to give us some more. And so again, we don't need as much sugar in our mouth, because again, the liver is giving it to us. So sometimes some of these, other, longer standing kind of sporting events that we're doing may not have the same impact immediately, but it may affect us later. And so again, that's where you might have to make some adjustments on the back end to, if you're taking insulin, or even if you're taking some oral medicine that's going to be affecting your glucose level.
Awesome, Amy. Thank you so much for breaking that down for us. And like Amy, but we also know like part of making sure that we are monitoring for hypoglycemia is checking our blood sugars. And we have people with type 2 who do finger pricks, and we have people who are on continuous glucose monitors. How do you work with patients in terms of like when to check your blood sugar, like before, during, and after physical activity?
No, and I'm more of a, oversharer when it comes to doing finger sticks and looking at CGM during activity, because we know that, because it's getting nicer, this might be your first endeavor out. And, again, you're going to be like, oh, you're going to be out for a lot longer. So I do tend to recommend that you're checking before, you're checking even every 30 to 60 minutes during, and then directly after, and then even 2 to 3 hours after you finish. Because again, we have to, that first time that you start doing any kind of activity, that's that first experiment to figure out, how does this affect me? And then, then you can kind of ease things up. It's of course a lot easier when you're using a CGM, because all you have to do is look. But I do strongly encourage that, every 30 minutes, take a look if you're on using a CGM. But, if you can, and you're willing, checking every 30 to 60 minutes with a finger stick while you're active.
Wow, that's such good information. I actually can't wait to take advantage of that when I go on.
But I mean, certainly, Tiara, think about it like, all right, I just gave you this information. You're like, now what am I going to do with it? So, certainly when we think about it, I liken, especially with exercise, I think of it like driving, again, if your blood sugar, obviously, if you're using your CGM and the arrow's screaming down, yes, you need some carbohydrate.
Right.
But, with a finger prick, we don't necessarily have that luxury of where the arrow is going. So, again, you want to take a look and see, well, if you're under 80, that's my general recommendation is if you're under 80, pop 10 to 15 grams of carbohydrate. Because again, sometimes what we tend to find is that our bodies, just with, kind of a strolling around the park kind of thing, you probably require about 10 to 15 grams of carbohydrate for every hour. Now, well aware of what I'm suggesting, because again, I'm telling you, eat calories while you're exercising. Like, is she psychotic? What is she doing? I'm trying to lose some weight here. So again, I say that's just kind of that upfront to figure out, those first couple times that you do it, just so then you don't go low. And then you can kind of start easing off and saying, yes, I'm only a 10 gram every 2 hour kind of guy, or a 15 gram every hour kind of girl. So, again, it's just, I'm like I said, I'm one of those worst case scenario girls that likes to make sure that you stay safe. I don't want like some EMT hovering over you in the park. That's what I'm more worried about.
I know for me, and this is just me, so I don't want anyone to be like, yeah, I want to do what she does. For me, I'm okay with hovering a little bit higher, than dropping too low, because that doesn't, especially when I'm usually by myself, like with my dog, but typically by myself when I'm out hiking. So I am so vigilant with making sure that I've eaten a little bit beforehand, making sure that people know where I am. So that way, like if they don't hear from me for a little while, you might want to just I'm gonna drop a pin and you might want to call someone. But also, like, another thing that I would love for us to touch on is like things like medication stacking or insulin stacking. Because sometimes you do have people who start, like, let's say you're going out for a bike ride and you're already at like maybe 200 or 300, and so you may take like a little bit of insulin just to kind of help you get going. Can you talk about what insulin stacking is, or medication stacking?
No, and insulin stacking usually occurs when you are trying to correct a high blood sugar in close proximity to dosing for a previous meal. So that's really, what's happening is that insulin has something called, insulin action. So again, it's, the technical term is pharmacokinetics and pharmacodynamics. I'm not going to bore everyone with that, but again, that's really what we're, it's looking at how the insulin starts to work, when it peaks or has its strongest activity, and how long it kind of stays in the body. Now, these are all very general guidelines, because again, some of this is just kind of like, everyone's different, but in general, rapid acting insulin is going to start working in about 5 to 15 minutes. So once you inject it, it's just going to start working. It's going to start peaking or have its strongest activity about an hour and a half to 2 hours later, and then it's usually out of the system within about 3 to 5 hours. Now, I'm not talking about the inhaled insulin. I'm just talking about the injectable ones.
Right.
So what happens is you say, all right, I'm eating my lunch. I gave, I'm using a 1 to 10 carb ratio. I gave myself 5 units for the 50 grams I took. I want to take a bike ride. And an hour and a half later, you look and you're like, oh my gosh, I'm 236. What on earth happened? So here's where, again, if you tried to correct your usual correction at that time, it would have been stacking right on top of that other insulin, and it's going to cause you to go low because you're basically, didn't give it enough time for it to do it. So the general rule is, if you're going to be correcting within 2 hours, you want to kind of cut your usual correction dose in half. But then if we're talking about exercise, you may want to even cut it down another half. So only take a quarter of it. So, again, those are very general recommendations, but, again, we want to kind of minimize the amount of insulin, because that previous insulin just hasn't finished working yet. So
Right. Absolutely. Thank you so much. Again, like I think that's important to know, so that way people aren't over medicating, because then like you may underestimate kind of even like the effect that the exercise may have on your body, and you don't want to get to the point where you're in the middle of a workout or towards the end, you're like, oh my God, I'm crashing. And then
no. Yeah.
So,
And one other thing, Tiara, is that where you inject your insulin is going to impact how quickly it works too. So let's say you inject it into your legs and then you're going for a walk. That could work a lot faster. So just keeping in mind, what exercise am I going to do? So I'm not kind of injecting into that body part, so it doesn't hyperlink into my bloodstream and do what it does a lot faster. So, generally speaking, if you are going to be really active, again, using kind of the abdomen is a nice, consistent, safe place to inject that's not going to be impacted by your activity, unless you're doing crunches. But, again, a different story,
is this would that also be similar for people who are, I guess, people with type 2 who are on some sort of insulin pump? to, I guess, adjust their basal settings or their or even look at like their insulin suspension delivery methods. I think the great thing about wearing something like an insulin pump is that you can actually set like a temporary basal dosages for things like exercise, and you can kind of pre-program it so that way you're not taking too much medication while you're trying to work out or something.
No, no, absolutely. And I know I was just having this conversation with a patient today in clinic. And, when we think about basal rates, adjusting basal, it does require a little more forethought, because again, when we think of basal rates, any change you make is going to have an impact 2 hours later. So again, if you're going to go for a 2 hour or more walk or a hike, like you said, Tiara, again, doing a temp basal reduction of 50%, or between 20 and 70%, those are kind of the guidelines. 2 hours before, during, and then after. Again, speak with your healthcare provider, because everyone is different. But I'd say we want to set those temp basals well before you're actually starting the activity, or cutting those surrounding boluses down around those activities to minimize the lows. But I agree that the pumps they're really useful. But again, it's about planning. We know that, as we said already today, is, again, we've gotten up to, all the what stuff do you need to bring with you to prevent hypoglycemia. And I know I showed this before, but again, that definitely does need to be in your little repertoire of, this is what I need to bring. But another thing that I also recommend, if you're not doing, especially if you're on insulin, and it's not because I like jewelry, I do, but again, make sure that you have a medical identification bracelet or necklace. Remember that first responders only look around the neck or the wrist. Doesn't have to get fancy. All it has to have is that cute little medical ID, the little emblem, and it just has to say diabetes, because again, first responders only look in those two places, and then they respond accordingly. So if they see diabetes, like, let's get back to the rig. Let's get them. That's the meter. Let's double check this, see where this person's blood sugar is. So.
Right. That's such that's a great recommendation, Amy. And also, like, on your phone, you can actually have I have an iPhone, but you can have a medical ID there as well, and you can share it with some of your emergency contacts. And you can, and for me, I know I put a type 1 diabetes. This is, I take insulin, and this is my pump and whatever. So that's also an option. And can we, to kind of like wrap up a bit here, like, can we actually talk about how to talk to your loved ones or your support system about helping you prepare for hypoglycemia, or how should loved ones of people with type 2 diabetes prepare for low blood sugars?
No, absolutely. And we all know that, yes, this is your diabetes, but again, no man is an island. So again, we want to make sure that all of your loved ones do have a good understanding of what to do in the event. Yeah. So that is going to be a conversation that you have with them, saying, okay, if I'm like, start doing something funny, and your symptoms for low blood sugar. So you want them to understand, when I am doing this, double check me, or have me check my glucose level, or, if I'm just not making sense, have me sit down and eat something. So again, kind of creating that plan and saying, again, this is, everyone's in this together. And, now with, new options for glucagon, it's not as scary to be like, oh my gosh, I'm going to hurt somebody. And one really important thing about glucagon is the safest thing to give, because all glucagon does is that it basically, like I told you about the glucose in the liver, it dumps all the glucose from the liver. And so again, it's going to raise the glucose level. Now, one really important thing, it only raises the glucose level about 120 to 170-ish points. So we're not talking through to the moon, it's, so just to kind of put that into perspective too, that, again, this is a safe thing but it's short-lived. So again, it usually works within 15 to 30 minutes. So again, making people just understand, all right, if I have these symptoms, please ask me to do this. If I'm not making any sense, and I'm just kind of, I'm not even responding to you anymore, this is what I want you to use. And then, so again, just really, really having that nice plan. Now, certainly, there are lots of, there's lots of tools that are out there that you can use. There's like this little hypoglycemia roadmap that's available through the Academy of Diabetes Care and Education Specialists.
I'll link to
Um,
that in the chat.
yeah, and so again, it's a really nice that you can just basically write down, here, this is what I need to do.
Yes, I love that. And I would also say, like, if you are experiencing symptoms of hypoglycemia, or if you're not, or if you feel like you're unaware, like, just next time you have like a low, write down what you are experiencing and take them to your doctor. And if you have a situation where someone does have to use something like nasal glucagon on you, definitely tell your doctor about that.
Yeah.
Because it is an emergency treatment, but it is definitely important to get checked out by someone, because just because of the acuteness of severe hypoglycemia. And then something else I would also recommend for people with diabetes is when you are talking to your family members and you want them to prepare it, let them know where they can find some of your material.
Yes, absolutely. Yes, yes,
So,
absolutely.
like, I think the thing about nasal glucagon is that it's in a bright yellow packaging. It's like hard to miss. Like, and if you keep it in your pocket, say like, hey, this bright yellow thing, get that. It may look like an inhaler a little bit. Get that. I need that.
And one thing also is that, again, it has like some cellophane around it. So again, don't get freaked out, because again, you're like, why isn't it opening? So again, I'd say that's one thing definitely that,
Yeah.
just making sure that you kind of walk them through that whole process. And Tiara, great point about, in the event that you have a low blood sugar, talk to your healthcare provider, again, because, don't look at this like a failure. Don't look at this like you did something wrong. Because again, everything, when we think of diabetes self-management, it's a journey, and if somebody does have a low blood sugar, it's telling us that we need to create a better plan and again, so it's really important that you do have that dialogue.
Yep, absolutely. Amy, that is just a perfect note to end this on. And I want to say thank you for joining me. This was such a fun discussion about hypoglycemia. Like,
it's not usually fun, I know.
the way you talk about it, it's so educational. And I hope all of our viewers in the Type 2 community just take just some really good gems from this conversation. Amy, would you mind telling people where they can learn more about you?
Well, where they can learn about me. So I work at the University of Chicago. So again, I'd say I'm probably on their website somewhere in their Department of Endocrinology. So, but it has been such a pleasure to be able to talk with you today, Tiara, and to be able to just talk with all of you too. You guys are my heroes. That's why I've been doing my job for as long, as because of all of you. You rock. Do not forget that, and keep fighting the good fight.
Oh, thank you, Amy. We need more certified diabetes care and education specialists just like you. Like, you make the field just so safe and educational. I love it. I want to say thank you to everyone who tuned into this conversation today. You've gotten some really great tips on just preventing or planning for hypoglycemia, and also what to do if you experience it yourself. Your medications have something to do with it. Where you inject insulin has something to do with it. Your family, your friends, whoever is in your diabetes support system, they're also going to be part of your hypoglycemia plan. In the description, you'll find a link to the hypoglycemia and type 2 diabetes awareness page from Beyond Type 2, the hypoglycemia roadmap that Amy mentioned, as well as information about nasal glucagon. So please check out those resources. Check out other resources on beyondtype2.org if you're interested in other ways to live a healthy life with type 2 diabetes. And if you want to connect with other people with type 2 just like you, go to our Beyond Type 2 app. It's a great community. We love it. We want you to join us. Trust me, we're a great bunch.
I love it.
Thank you everyone for tuning in, and we will talk to you next time. Bye.
Bye, everybody.